Hi, my name is Sarah, and I am a pharmacist practicing within a medical cannabis dispensary in the state of Connecticut. I had switched gears into this industry over 4 years ago as I refocused my priorities towards overall health. In my career, to help patients find safe and effective alternative care methods, and in my personal life, to live as clean as possible between diet, exercise, and a non-toxic lifestyle. This has been one of my most rewarding journeys yet, and I'm here to talk to you about the role of the pharmacist within the medical cannabis industry. Regulations between states differ significantly, with there being several states with medical programs, many more with recreational use, and very few who require the pharmacist for dispensing. Connecticut happens to have one of the most restrictive medical programs in the country, so I'll tell you a little bit about what we do here. Patients can become qualified for the program by a physician should they determine the patient is suffering from one of the over 30 qualifying conditions in the state. These range from chronic pain, cancer, glaucoma, epilepsy, inflammatory bowel disease, and many more. Once qualified, a patient is required to meet with a pharmacist at a dispensary for their initial consultation. It is during this consultation that the pharmacist will discuss their diagnosis, symptoms that are associated with the diagnosis, as well as secondary concerns, additional health conditions which may impact recommendations or formulation usage, current medications, both pharmaceutical and over-the-counter, to ensure drug-drug interactions are reviewed and addressed, allergies, specifically food allergies, as many formulations have added ingredients, and their history of use. The pharmacist will provide education on basic pharmacology and strain diversity, as well as discuss in depth the different formulations available and the characteristics associated with each, and then finally provide recommendations for the patient. Recommendations come with precise dosing schedules, and follow-ups are highly encouraged as the goal is to obtain the most optimal results to manage their condition. Whether you are a pharmacist practicing within the industry or not, there are some key aspects to familiarize yourself with as this industry continues to evolve. First, drug-drug interactions with cannabis, primarily THC and CBD, do exist, so it is important to be aware of the most common, as this can be used to screen and discuss with patients as you may be filling these other pharmaceuticals. Utilize the prescription drug monitoring program to identify cannabis use, as dispensed product from the medical program is reported daily. Secondly, discuss with your patient other medications being used, such as over-the-counters, herbals, and marijuana. There are many beneficial uses for cannabis, and it is relatively easy to obtain between dispensaries and CBD shops, so you may find that as you start to open up the conversation surrounding this, patients may be more apt to sharing. These conversations can lead to valuable consultations that will leave your patients more informed to make safe medical decisions and build your relationship. The role of the pharmacist in the cannabis industry has significant advantages to providing valuable information to patients so they are able to medicate safely as well as maximize results. I hope this provides clarity on the pharmacist's role in an ever-changing industry as the volume of cannabis usage is increasing and pharmacists can help educate to keep patients safe.